All right, let's talk about something that seems like it should be simple, but really isn't. Marketing healthcare. You'd think something so essential would be easy to talk about, right? Well, today we're going to dig into why it's so incredibly difficult, looking at something economists call market failures. And we'll see how the whole industry is trying to find new ways to connect doctors with the patients who need them. So let's just jump right in with a question. Why is it actually harder to market a hospital than it is to market, say, the newest smartphone? I mean, think about it. Our health should be the easiest product in the world to sell. But it turns out the reality is way, way more complicated than that. And here's the thing. The simple answer is that healthcare, well, it just doesn't play by the same rules as everything else. The marketing playbook that works for selling cars or phones or even coffee, you can pretty much throw that out the window when what you're selling is someone's well-being. I mean, it is a total obstacle course. For marketers, it's like trying to navigate a maze blindfolded. You've got all these complex regulations and really important ethical lines you can't cross. You're trying to reach all these different kinds of patients in all these different communities, and you have to do it all while following super strict privacy laws like HIPAA, the one that protects our health data. One wrong move, and the consequences are serious. So you take all those hurdles, and they add up to something that economists have a specific term for, a market failure. And listen, this isn't just some marketing jargon or a simple headache for an advertising agency. No, this points to a much deeper, more fundamental crack in the very way our healthcare system works. Okay, so what is a market failure when we're talking about health? Putting it simply, it's when the whole system just fails to efficiently connect the right patients with the right care. And that failure? It creates these massive gaps in everything, from just finding new patients to keeping them engaged in their own health, and even to building a brand that people can actually trust. This is really the root of the whole problem. Okay, that's the big picture economic idea. But how does that actually affect real people, like you and me? Well, these market failures boil down to three huge, tangible challenges, both for the doctors who are trying to provide care and for all of us, the patients who are trying to find it. And here they are, the big three. Number one, just getting patients in the door. Number two, keeping them actually engaged in their own health journey. And number three, building a reputation, a brand that people truly trust. So let's break each of these down. All right, first up, patient acquisition. So the problem is, how do you find the specific people who need your specific services? They're scattered across all these different communities, and you have to find them while playing by really strict privacy rules. So what's the solution? Well, it's definitely not about putting up a bunch of billboards anymore. It's about using smart, multi-channel strategies and really targeted ads that can reach the right people without ever crossing those ethical lines. Okay, next up is patient engagement. For the longest time, communication in healthcare has been a one-way street. The doctor talks and you just listen, right? Well, we all know that just doesn't cut it anymore. The real solution is about genuinely understanding what patients need and then using every channel available. We're talking email, mobile apps, you name it, to give people the educational tools they need to feel empowered and take an active role in their own health. And that brings us to the third challenge. Brand awareness. Look, we live in an age of online misinformation, right? So how on earth does a hospital build trust? It is absolutely not about running generic ads anymore. It's all about having a unique strategy and proactively managing your reputation so you can become that source of truth that people are really desperately looking for. So if the old marketing playbook is basically useless here, what takes its place? The answer, it lies in a totally new, modern, data-driven toolkit, one that's built from the ground up to handle the unique complexities of healthcare. This new toolkit, it's all about being smarter, not just louder. It means using data to really understand what a patient's journey looks like. It means creating content that is genuinely helpful to people. It means meeting them where they already are, on social media, on their phones, and maybe most important of all, it's about making every single interaction feel personal. And, there's a quote from the source material that just nails this idea perfectly. It's not about marketing more. It is all about marketing smarter. And by embracing this data-driven way of thinking, healthcare providers can finally start to overcome those big market failures we were just talking about. Okay, so this all sounds great in theory, right? But does it actually work in the real world? Well, let's take a look at a case study. There's this company, Digby Health. They help people reverse chronic illnesses, which is amazing, but they were really struggling to grow. So after they started using these kinds of strategies, their website traffic grew by 500%. Let me say that again, 500%. And get this, it was in just 3 months. That's incredible. So you have to ask, how did they pull that off? Well, it wasn't some magic bullet. It was a combination of really smart, modern tactics. They did deep keyword research to figure out exactly what patients were searching for online. Then they optimized all their content to actually answer those questions. And they took these powerful patient testimonials and repurposed them into super engaging content for social media. But a success story like that isn't really an endpoint, you know? It's more like a signpost, showing us where all of this is headed. Because the healthcare marketing world is changing fast. So let's take a quick look at what's on the horizon. Get ready, because we're going to see way more AI being used for personalization to make communication with our doctors and hospitals feel truly one-to-one. Think about the rise of voice search. Asking Alexa or Siri for health advice. That's going to completely change how we find information. And holding all of this together will be an even bigger focus on the total patient experience. And of course, absolutely ironclad data security. That's non-negotiable. And all of this brings us to a really interesting final thought. As marketing gets better and better at closing these gaps, at solving these market failures, it's doing more than just helping hospitals get more patients. It's actually changing our relationship with the entire system. So I want to leave you with this question. As these new tools give us more information and more access than ever before, how does that transform our own role and our own responsibility as patients in managing our own health?